What are some other risk factors or some of the causes of heart failure that people should be aware of? And they should try to monitor or modify those risk factors to keep their hearts healthy for as long as possible.
If you look at the new American Heart Association EC guidelines, they came up with this classification system called A, B, C, D. A, I'll go to B. B is when you have a structural problem in the heart, but you don't have symptoms. You just go out, okay, I'm really concerned. I want to get my heart checked. I go get it checked. My heart function, ejection fraction turns out to be 35%. That I would be dropped into stage B heart failure, structural issues, no symptoms. C is when the symptoms do happen and we start treatment. We want to stay in C and get out of C and back into B, meaning we have some structural issues, but we have no symptoms. We're living our life. That is what most of the people out there should be doing, being in stage B. But what you're asking is, so what, how can we prevent? And that's where the stage A comes in. Stage A means that you don't have structural abnormalities in your heart. You do not have any symptoms. It could be all of us, right? Me, you sitting right now. Risk factors for heart failure. Number one is hypertension. We really advocate good risk factor modification. Hypertension, diabetes, renal failure over time. These are obesity, valvular abnormalities. If you've had rheumatic heart disease in the past, a rheumatic fever, you could have a valvular issue. These are all risk factors for developing heart failure. So the emphasis why that was what we call pre-heart failure, stage A, was built was to emphasize importance of treating risk factors. When patients come to a cardiologist, we want to talk to them about what's your blood pressure doing? Are you getting good enough sleep? What is your nutrition look like? What is your weight looking like? Weight is such a key piece because at some point, at least in this country, the food industry did some lobbying. They wanted to increase their profit margins for their shareholders, right? How do you do that? I can't get enough sugar canes for
Hmm.
sugar, so let me go and talk to the guy next door who's just come up with the great genetically modified corn that grows larger, is more fungal resistant. There's going to be a lot of it, right? So now you have corn and he's doing all sorts of stuff with it. He's got a really thick syrup coming out called high fructose corn syrup. It's available readily. Let's get that and let's replace the sugar in my product with high fructose corn syrup. I'm going to have a better margin. My shareholders will be better.